A very good afternoon to all the students. Today we will be discussing about the parietal bones. So let's start our demo on parietal bones. So when we look at the skull from the superior view, we can see a pair of bones forming the roof as well as most of the lateral part of the skull. This pair of bones is known as the parietal bone. Now, if we look at the individual parietal bones, we can see that they are quadrilateral in shape. They have two surfaces, the outer surface which is convex and the inner surface which is concave. It also has four borders and also four angles. So these four are the angles. Now, first of all, we have to determine to which side this bone belongs. For that, we have to look at certain features of the bone. Now, the superior border is always straight, long, and longer than the other borders. Like here we can see, and the inferior border is curved or notched. So here we can see this is the inferior border. So after determining the superior and the inferior border, we have to look out for the anterior and posterior. So we can see this angle. It is acute and elongated. This is known as the antero-inferior angle. So using this, we can say that this is the parietal bone of the right side. Similarly, here we can see a straight and large superior border, curved notched inferior border, and acute angle anterior-inferior border elongated towards the front. So this is the parietal bone of the left side. So after determining to which side the parietal bones belong to, let us look at some further details. So quickly summarizing, as you can see, this is the long superior border, this is the curved inferior border, the anterior border, the posterior border. The angles are named as the antero-superior angle, the antero-inferior angle, the posterior-superior angle, and the posterior-inferior angle. These angles can also be named as per their attachments to the bones. So as we can see here, the anterior superior angle, it is articulating with its counterpart, and both here are articulating with the frontal bone. So the anterior superior angle is also known as the frontal angle. Similarly, here we can see the posterior superior angle here is in contact with the occipital bone, so we can call it the occipital angle. So looking at the inferior borders, we can see the antero-inferior border articulating with the greater wing of the sphenoid bone. So this antero-inferior angle is articulating with the greater wing of the sphenoid bone. So the antero-inferior angle is also known as the sphenoidal angle. Similarly, we can see the posterior-inferior angle is articulating with the mastoid part of the temporal bone. So it is also known as the mastoid angle. So repeating again, this is the antero-inferior angle articulating with the greater wing of sphenoid, hence also known as the sphenoidal angle. So this is the sphenoidal angle. Similarly, this region where the parietal bone is articulating with the mastoid part of the temporal bone is known as the mastoid angle. So discussing about the other features which can be marked on the external surface. Now if we look from the superior view, we can see these regions. These regions they show the maximum protuberance or maximum convexity, and we can between these two. This is known as the transverse diameter or also the biparietal diameter. So this maximum protuberance that we see, it is known as the parietal tuber, and the distance between these two is known as the biparietal diameter. We can see like this distance from one parietal tuber to other is known as the biparietal diameter. Now it has some important clinical significance. So looking at the individual parietal bone, here we can see the long superior border, the curved or notched inferior border, the sharp acute angle, antero-inferior angle. So this is the anterior border. From the superior view, you can appreciate the parietal tuber, and just below the parietal tuber, you can appreciate the presence of two lines, the superior and the inferior. These are known as the superior temporal line and the inferior temporal line. These temporal lines, we can see they are distinct anteriorly. However, when you move backwards, they become much less distinct. Now, these temporal lines, they provide important attachments. The superior temporal line provides attachment to the epicranial aponeurosis as well as the temporal fascia, whereas the inferior temporal line, it gives attachment to the temporal muscle, temporalis muscle, and the region below this is forming the greater part of the temporal fossa. Now we have seen the features of the external surface of the parietal bone. Now moving on to the borders. Here you can see the anterior border. It is serrated starting from the middle, and as we move laterally, you can see it becomes beveled. This anterior border, it articulates with the frontal bone to form one half of the coronal suture. Now the superior border, as we can see, this is also serrated and it articulates with the parietal bone of the opposite side to form the sagittal suture. Now the posterior border, it is also serrated and it articulates with the occipital bone to form the lambdoid suture. Also laterally we can see it will articulate with the mastoid part of the temporal bone. And finally the inferior border, it is unlike the other three borders. As you can see, it is beveled in its shape, and this articulates with the squamous part of the temporal bone. So now that we have discussed about the individual parietal bones and their articulations, we need to look at certain important landmarks. Like here you can see the sagittal suture and the coronal suture meeting. This point is known as the bregma. Similarly, if you look posteriorly, this sagittal suture is meeting the occipital suture, and this region is known as the lambda. The sagittal suture is meeting with the lambdoid suture, and this region is known as the lambda. Now these two regions, they are important because in a neonate these two regions are not fused and they form the anterior and the posterior fontanelles. So here are two fetal skull specimens showing the presence of this unfused region here. This is known as the anterior fontanelle. Also in this fetal skull you can clearly appreciate the presence of the parietal tuber. Also here we can see or appreciate the presence of the unfused region. This is the region of posterior fontanelle. In the adult skull, these regions are fused to form the bregma and the lambda. Now moving further, another important feature is at the posterior end of the superior border, we can see the presence of a foramen. There may be some variations, as we can see only one foramen is here. It can be also present on both the parietal bones. Now through this foramen passes the emissary vein, which connect the veins of the scalp to the superior sagittal sinus. So this foramen is known as the parietal foramen. Now let's move on to the inner surface of the parietal bone. Before that, let's orient ourselves. As we can see, this is the curved border, so this will be the inferior border, and here you can see the acute angle elongated structure, so this is your antero-inferior angle. So this is the parietal bone of the right side. Now as you can see, there are several vascular markings which are very prominent on the inner surface. Also, on feeling the surface, we can appreciate various protrusions and depressions. These depressions are formed due to the gyri, and the vascular markings we see, they are formed due to the middle meningeal vessels, mainly the middle meningeal veins. So these vascular markings, which we can see originating from the antero-inferior angle and moving upwards and backwards, they are from the anterior division of the middle meningeal vessels. Similarly, here the vascular markings just in front of the posterior-inferior angle, these are the posterior division of the middle meningeal vessels. If we look at the inner surface of the superior border, we can appreciate one half of a groove. If we join the parietal bone of the opposite side, then these two bones together will form a continuous sulcus which lodges the the sagittal venous sinus, and this sulcus is known as the sagittal sulcus. So here my probe is placed in one half of the sagittal sulcus which lodges the superior sagittal sinus, and on the borders of this sulcus is the attachment of the falx cerebri. In old age persons, we can appreciate certain pits present just at the border of the sulcus. These are due to the arachnoid granulations, and they help in draining the CSF into the sinus or the superior sagittal sinus. So here you can see the sagittal suture from the inner aspect of the skull between the two parietal bones, and this midline sagittal suture, this will be lodging the venous sinus, the superior sagittal venous sinus, and this is known as the superior sagittal sulcus. And on its margins will be the presence of the uppermost part of the falx cerebri, which is attached to the lateral margins. Now you can appreciate that my probe is present at one of the arachnoid granulation pit, which is draining the CSF into the superior sagittal sinus. So now let us discuss about the relations of the internal surface of the parietal bone with the regions of the brain. For that, we need to draw an imaginary line which begins 2 to 3 centimeters behind the anterior-superior angle. So it will begin from here. It is then drawn passing forwards and medially. So it will be like this. So in front of this imaginary line will be lying the frontal lobe, and behind will be the parietal lobe. So this imaginary line, it lies along the central sulcus. Now if we draw another imaginary line starting from the antero-inferior angle towards the parietal tuber like this, so in front of this line will lie the frontoparietal lobe, and behind in this region will be the parieto-occipital lobe. So now that we have discussed about the presenting features of the parietal bone, now we move to discuss about the ossification of the parietal bones. So as we have seen till now, the parietal bones, they are flat bones which are quadrilateral in shape, and they have 4 borders and 4 angles. So as we can see from above, this region is the region of maximum protuberance, which is also the parietal tuber. So this parietal tuber is the region where the ossification of the parietal bone starts. To understand this better, we'll look at it in a fetal skull. So here you can see this is a fetal skull and this is the region of parietal tuber. At the age of 6 to 8 weeks, there is the appearance of two primary ossification centers at this region of parietal tuber, and the ossification it proceeds, as you can see, radially or centrifugally. These lines also represent that, and as the ossification progresses, the borders are the first to ossify, whereas the angles they remain as membranes, which ossify at a later stage. So these unfused structures are known as, here you can see the anterior fontanelle, the posterior fontanelle, the anteroinferior or the sphenoidal fontanelle. This is known as the posterior inferior or the mastoid fontanelle.